Good afternoon, everyone. My name is Lisa Holland, and I'm in the Communications Department of Families USA. Thank you for joining us for our roundtable, United for Health, a dialogue on healthcare reform. Families USA, Elizabeth Mitchell, President and CEO of Purchase Business Group on Health, and John Ahrensmeyer, Founder and CEO of Small Business Majority. They will discuss the unity across stakeholder segments that want Congress to prioritize healthcare and recovery legislation. Afterwards, we'll take questions. You can ask questions by posting them in the chat box or by using the raise hand feature and turning on your mic and camera. My colleague Adina Marks will call on each participant. So we're going to get started now, and I will turn it over to Frederick.
Thank you, Lisa, very much. And I've got some coffee right here. I wish I could hand it through the screen to you. Thank you to everyone for joining. A very, very big thank you to Elizabeth and John for being here. This is quite a week. Congress is coming back from their Memorial Day recess. They got a lot of work to do to put together their priorities for the next recovery package. We also know that because of the razor-thin margins in both chambers, moderate Democrats are publicly pushing back on some critical progressive priorities like voting rights. So in this environment, it is important to highlight the powerful opportunities for victories that Congress can act on immediately that cut across ideology and party politics, policies that are widely popular with families across the political spectrum. In that spirit, our organizations are coming together today to share why health, and in particular healthcare affordability, should be at the top of the congressional priority list right now, in this moment, and for this year. Health should not depend on our wealth. Healthy individuals and families are key to realizing a thriving economy and resilient communities. As our nation rebuilds from the COVID health and economic crises, we need to make sure all people, families, individual workers, and seniors can afford the health care that they need. So in that spirit, let's talk a little bit about why Congress and the president should prioritize healthcare affordability and prescription drug prices in particular at this moment. All of us here know the cost of healthcare is too high. Millions of people across this country are having to make impossible choices between things like getting the care they need and putting food on the table. Whether you're talking to voters, healthcare consumers, business owners, large employers, healthcare costs are top of mind. That includes prescription drugs, dental care, premium costs, and medical care for people who just simply can't afford insurance. So Elizabeth and John, can you tell us a little bit about how this issue impacts your individual members? And Elizabeth, if you like, why don't you go first?
Sure. So healthcare spend is typically second after wages for employers in this country. And the higher the healthcare spend goes, the more of a drag it is on business, on wage growth, on expansion of US businesses. And it has become a significant concern, even for jumbo private employers. And we just had survey that came back that actually even surprised us with a sort of level of concern at the C-suite of some of our top corporations, where 87% think that the cost of providing health benefits to employees is going to become sustainable in the next 5 to 10 years if it isn't already. And for the first time, we are seeing readiness from private employers to look for government intervention, because it isn't working. The industry is not responsive. No matter how hard our members look to innovate and do direct contracting or value-based purchasing, generally, we can't penetrate the opacity, the consolidation, and we just can't get the best care for our employees. Our members continue to pursue that. They are absolutely committed to sustaining the health and well-being of their employees. But right now they are looking for government support in some cases to address the egregious pricing and the anti-competitive behavior that they're seeing in the market.
Thank you, Elizabeth. And John, you represent smaller businesses. What's going on for them right now with regard to healthcare affordability?
Well, cost has always been a huge issue for small businesses, healthcare costs in particular. And although it's gotten a little better under the ACA with the pandemic, it's now putting additional pressure on it. Research we just completed and released with Families USA, in fact, half of entrepreneurs say that healthcare costs are one of their top two barriers to maintaining and growing their business. Over a third have report they've struggled to obtain health coverage for themselves and employees during the pandemic. And these numbers are more dramatic when you look at Black-owned businesses, 50% say that, AAPI-owned businesses, 44%, and Latino small businesses, 43%. So you're talking about a situation that's already been a problem, and now has become even more drastic as we come out of the pandemic.
Thank you, John, very much. And as you said, we've done polling, other folks have done polling, and it's really powerful. I mean, what we've just recently released, 3 in 4 voters say healthcare should be a high priority for the president and for Congress this year, including a strong majority of Democrats, Independents, and Republicans. And a startling 9 in 10 voters want action to lower prescription drug abuses, pricing abuses this year. The time really is now. Let me ask you another question. Elizabeth, you represent employers who self-insure, meaning they typically hire an insurance company to administer benefits, but carry all the risk of the healthcare costs. And then John, you represent small businesses that tend to fully insure, meaning they hire a health insurance company to take full risk providing health insurance benefits. Despite these important differences, you both strongly support affordability, government intervention around affordability, and particularly drug pricing. Can you talk a little bit about why this is so important to your members? John, if you want, why don't you go first?
Sure. I mean, as business people, our members are used to being in a truly competitive marketplace where they can negotiate with people they're buying supplies from, where there's often a non-monopolistic market out there. Here, it's a take it or leave it. There's no choice. If you want to provide coverage to your employees, you're stuck. And it's very frustrating as business owners for us to sort of have this dagger hanging over us and really not be able to do anything about it. And that's why it's really critical that Congress step in and address this issue.
Thank you, John, very much. How about from your perspective, Elizabeth?
I would say that jumbo self-insured employers have almost as hard a time purchasing high-value drugs as even smaller employers. Again, these are business people. They would welcome a competitive market if that were on the table, but there's no transparency. There's no ability for competitive drugs to sort of get into the market effectively. Frankly, there are limits on negotiation. The federal government is prohibited from negotiation. That is not a normal market. And we think that not only should the government be allowed to negotiate, but the benefits of those pricing, if there are pricing concessions, should be extended to the entire market, to all purchasers. So again, it's not that we don't support a private market, but we don't have that now. So we need some sort of intervention to make the market work.
Thank you, Elizabeth, very much. And from the perspective of Families USA, of course, for all of the families that you guys are insuring, this is critically important because it's their premium costs that get impacted, their paychecks that get impacted, and then fundamentally for all of us who might be buying the goods and services that your folks are making, those prices also go up, all because of this. But then we see the same problem happening for individual families who have to make choices between, as I said, food and buying their prescription drugs. We see the Medicare program. It affects the solvency of the program, the ability of seniors to be able to take care of themselves and their health. So this ripples across all the different facets of our society. It's businesses, it's families, it's government programs, all of them are suffering because, as you both point out, we don't have a real functioning market when it comes to so many of our healthcare services. It's a distorted market. We don't have competition. And not only does that mean our prices are out of control, it also means we're not getting the quality and the kind of health and healthcare that we deserve as a country, spending 2 or 3 times more than the rest of the world. These are really important points.
Go
ahead, Elizabeth.
Frederick, because to their credit, our members, their top priority is buying the highest quality care for their employees. I mean, our members collectively spend about $100 billion a year on healthcare. They are not nickeling and diming anything. They are spending handsomely because they want the highest quality care. Unfortunately, because of the lack of transparency and frankly, just the challenges of navigating the market, it's hard to find the best quality care. And we know we've demonstrated it in multiple pilot initiatives. Better care does cost less. So they want to partner with physicians who are willing to really meet their quality standards and transparently share those results, because they really do believe that there is an opportunity to get better care, and that reduces total spend.
Really important points you're making, Elizabeth. And one thing that comes out in my mind often is that there's sometimes a misperception that fee for service, so just paying for the care that you need, is incentive neutral. Doctors will just sort of say, like, here's what you need, go get it, right? But the data are so clear on this. Fee for service actually creates really perverse incentives. And sometimes those incentives lead to the wrong care, too much care, and particularly end of life. You see really terrible outcomes for people in the last few months of their life. So it's another example of how distorted the incentives are in the healthcare system.
And if you take it to the extreme, in a fee-for-service system, if people stay healthy, no one gets paid. We have got to change that so that we are paying for health outcomes. That's what our employer members want.
Yeah. And one of the points I was going to make really quickly on this issue was, as you guys both have said so eloquently, you want competition, you want a real market, right? And often what you hear from drug companies in this space is scare tactics around the idea that if you do anything at all to try to create a reasonable price for our product, you're going to kill innovation, meaning you're going to lead to people's not having the benefit of life-saving drugs. And I think a really important point on this is a high functioning market with real competition would allow competition to lead to innovation. But every day that we let a drug company set their price, it's not based on the value of what they're offering, not based on the improvements in people's lives that they're making or the protection to people's health that they're offering, but rather the tricks of lawyers, patent thickets, making sure that nobody can ever compete with them, even if the thing that they're producing is of higher quality or less expensive. What we're really doing is incentivizing legal tricks and games, not the kind of life-saving innovations that we all really, really want. And as you said, Elizabeth, we fight hard to get value out of healthcare, but all of these are all examples of the ways in which the system is stacked against businesses and people and governments trying to get that high value care. One last question before we turn to any questions from the press. Proposals in Congress right now have central provisions that do two things: that either address the launch price of a new drug and or the annual increases in drug prices. From your perspective, are both policies important? Should both be included in whatever Congress ends up moving? John, you want to go first?
Yeah, I mean, both are important, and it really comes down to having getting prices under control, so the costs of coverage is under control. And I want to add to your point you're making before. It's kind of perverse. We as business owners know that you get the most innovation when you have the most competition, and it's quite the opposite. So the argument that somehow you're not going to get innovation by not having price competition is crazy. But yes, I mean, any pressure that's going to bring prices down and create a situation where you're paying for the value, the cost, the value, and a reasonable profit is exactly what our members want.
Thanks. How about you, Elizabeth?
Completely agree. And the effort is put into limiting competition and avoiding transparency and accountability. Compete on the efficacy of your product, compete on the value and the service. And we think that would lower prices, but in the absence of the ability to have a free market, then we are looking to government to step in.
Well, thank you, Elizabeth, very much. And John, we are all coming from this from different perspectives, but there's definitely, we're speaking with one voice here. It is time for the government to be able to come in and fight hard to give American families, American businesses a fair shot at high value, lower cost healthcare. There's no question. And the public want it. Elected officials need to show up and get it done. With that, let me turn it back over to Lisa to see if we've got questions from our audience.
Thank you, Frederick and Elizabeth and John. I think that was an important discussion that you had, different perspectives, speaking with one voice, and then underscoring that we're trying to pay for health outcomes. And the most innovation occurs when you have the most competitions. That a lot, struck with me from the conversation, but really sort of pulled those. So let's see if we have any questions from our friends from the media. Feel free to drop your question in chat or raise your hand, and my colleague Adina will call on you. Using the raise your hand feature, my colleague Adina Marks will call on you. And I don't see any questions in chat, so we're seeing if anyone's going to raise their hand. Any questions that you have about the polls and the different perspectives, and is this unique for different stakeholder groups to come together like this? Any types of those questions? Well, I'll ask one. To the point I just made, is this sort of unique where we have different groups coming together on something like this, or is this pretty typical in you all's experience? To me, it shows that no matter who you are, you care about families, and we're all impacted by this, and I feel like that's what it shows. Is that kind of how you all feel?
Well,
All of us, large, small, and otherwise, are consumers of healthcare, and ultimately, the product, if you will, it's not about whether it's a big business or a small business. It's the individual, it's the employee, or in our cases, many of sole entrepreneurs. And so you're talking about a product that basically applies the same to all of the folks that we care about in our universe. And it's not surprising to me at all that we have a common set of goals here, which is to make sure we have pricing for drugs that is competitive, and that provides the most value for the least cost.
Yeah, I completely agree. I mean, whether you're an employer or a family or an individual, you're the customer of the healthcare system. And we are looking for the system to be responsive to the needs of those paying for and receiving care. And it is not at all surprising that we're coming together, because I think the frustration level is so high. We've waited for years for the industry to sort of respond and reform itself, and it just hasn't happened. And you're seeing increases that are just accelerating, particularly around specialty drugs, for instance. And as purchasers and employers try to maintain affordability for their employees, it is getting harder and harder to do that. So they are more and more looking for partnerships to take this on.
Yeah, and that was the point I was going to make, is I think that seeing this kind of alliance is a real signal to politically also what's going on, which is ultimately, we're talking about one of the wealthiest, if we talk about prescription drugs, for example, one of the wealthiest industries in the world. It's well over $1 trillion in revenue across the world, across the globe. They also spend more on lobbying DC and many state capitals than any other industry. So in a way, this is a real David and Goliath moment. This is a very, very powerful, concentrated interest. They know how to work the levers of power in DC. And ultimately, it takes this kind of alliance from families and consumers to businesses to labor unions and other folks all coming together and saying it's time for the abuse to end, or this isn't going to happen. And so it's this kind of alliance is so important to be able to push back on the really heavily concentrated and moneyed interests that the pharmaceutical industry and other elements of the healthcare sector represent.
Wonderful. Thank you guys for that. David Hogberg of the Washington Examiner has his hand up. David, did you want to ask your question?
Yeah, just real quick. I heard this mentioned maybe once or twice, and maybe you could talk about it a little more broadly, if you can. Consolidation among health insurance companies has to some extent been increasing. To what extent is that a problem in terms of competition and how it affects your bottom lines?
Oh, I got that. So we actually wrote a letter to Congress over a year ago saying that there should be a moratorium on hospital mergers and consolidation during the pandemic, because we saw, you know, billions of dollars going to these hospitals and a lot of smaller providers getting very vulnerable to acquisition. And we anticipated correctly, unfortunately, that there was going to be a spate of mergers and consolidations. And what happens, the research shows, is that it does not improve quality, it worsens experience, and it drives up prices. So there's not a lot in mergers and consolidation for purchasers and patients. There's a lot in it for the industry that gets to raise its prices. So we've been very concerned about that. Sutter Health is probably the poster child for some of the more egregious behaviors that are possible through a consolidated system. We were successful after about 10 years in court. We're looking at hopefully a completed settlement by July, and they're going to have to repay unions and businesses and families over $575 million because they were overcharging that amount. They're also going to have new rules of the road in terms of, more transparency required. You can't do all or nothing contracting anymore. All of the sort of abuses of the system are being addressed in those injunctive relief provisions. So we know there's a problem, and Sutter is not alone. This is a widespread phenomenon, but we also know that when you do something about it, it can benefit those purchasing and receiving care.
I was going to pick up on that really quickly and just say that one of the central players in a lot of that work is our new Secretary of Health at HHS, Secretary Becerra. And fundamentally, the problem we saw in Sutter and that we've seen in other mergers in the healthcare sector is, as Elizabeth and John have said so beautifully, these are just classic economic market distortions. This is very well understood. If you have monopolistic pricing, if you have asymmetry information, Elizabeth touched on how opaque the healthcare data and information are. We can't even know how much, I can't know as a consumer how much I'm paying, but even when an employer is footing the bill, they often have to struggle for months and months and months to figure out what the actual price is of what they're paying. When we don't know price, when we don't know quality, when we don't know what we're paying for, what happens in a market that also is heavily subsidized by either the government or employers, right? You have terrible pricing abuses. And so, David, your question is about another problem, which is health system integration that can lead to really abusive price setting as well. Really important to say, though, that drug companies, I think, have been taking the greatest advantage in terms of the way that prices are increasing, not as a total set of all the prices being paid, but the rate at which they're escalating, and also the degree to which the government has given drug companies such free rein to set those prices. And so there really is this moment right now at this moment in time where we could really make a difference by passing legislation that allows the government to get in there and negotiate and stop the abuses.
Yeah, and I just add that, again, to repeat, we have no power to negotiate any of this. It's a take it or leave it. And the fewer players there are out there, the fewer options there are. So, this is why it's just not a market that's functioning in any way. It's the one product or service that our members need, that they have no control over, no control over where they go or what the pricing is. So this is why we really need help at the upper level.
Thank you. I was just jotting down that you said this is the one product that folks need that they don't have control over, and that's obviously very concerning. Any other questions? We've got a few more minutes. We could take a few other questions or comments from our friends in the media. And I don't see anything in chat. Well, did you, again, really appreciate this discussion. Anything that you wanted to add? Like Elizabeth, I was really struck by, I think it was on 60 Minutes recently, the Sutter case. Did they approach you? It sort of shows that a, largely consumer, outlet like 60 Minutes, would reach out and would want to cover that. So do you have any thoughts about that as to how this issue is kind of gaining national attention?
It's funny, we worked quite closely with the producer after they approached us. They just couldn't believe how egregious it was. I just don't think people fully understand. They assume jumbo employers can just, walk in and buy whatever they would like. That is simply not the case. And I mean, again, as John said, they control their supply chain. Imagine a manufacturer not having the ability to select, the different component parts for something that they're producing without, any sort of visibility and transparency and accountability. It's just impossible in healthcare to make that work. And again, they are looking to pay a fair price for a high quality product. And we don't think that that's too much to ask, but we have to enable that to happen.
Yes, exactly. A fair price for a high quality product. I like that too, because I think there's a misconception on that. A few more minutes. Any other takers before we start to wrap up? No. Okay. Any closing thoughts from our speakers? And again, this was a very good discussion, very important polls, and again, showing that diverse stakeholders, one action. So yes, before we wrap up for today, any other comments?
Yeah, I'll be brief, but this can't be ignored. This is affecting families' day-to-day lives. It's affecting the businesses that are at the heart of our economy. We're trying to come back from a pandemic. We saw, clearly how much health will influence, our economic success in the pandemic. This is part of our infrastructure. We need a healthcare system that enables people to be healthy and go to work and, take care of their families. So I guess I would just, really urge Congress to think about how essential this is for our economic future and for the future of our American families.
Yeah, let me just add that small businesses consistently, even pre-ACA, when prices are going up double-digit percentages every year, really want to make sure their employees and themselves, quite frankly, are covered. And that is a huge priority, and it's not always. Sure, it's a bottom line priority sometimes in terms of competing against a larger business for employees, but they want to do the right thing. They want their employees are often like family to them. They want to make sure they're covered. So this continues to be a top priority for businesses. No surprise that 90% of businesses in the poll I just referenced support government intervening to control drug prices, and it's something that we're passionately focused on, and look forward to mobilizing those small business voices as Congress begins to consider this.
I think the closing comment I would make is we're watching the realities of a very, very closely split Congress right now, and we're watching. President Biden has come out loud and clear and said that he really wants to work hard on this prescription drug pricing, as well as other healthcare price issues, affordability, making sure, for example, that coverage in exchanges is affordable, potentially creating a new oral healthcare benefit, Medicare. These are all things that will create much more financial stability for the people in this country. And in this moment, when there's such a push-pull between the moderates and the progressives, between the Democrats and the Republicans, it's hard to think of a better issue for Congress to take on right now. This is wildly popular. The abuses are so extreme. Nobody's fooled. The American public, poll after poll, knows exactly what's going on. They're getting ripped off. And so despite it being a David and Goliath fight, meaning that for example, the prescription drug companies just have massive amounts of money to throw at this, try to stop it. We've got the public on our side, And we've got an issue that isn't seen as partisan. It's seen as simply fairness and about getting a good deal for the people, for businesses, for government. So I think that we may be at a pivotal moment where we're going to see more and more focus on this issue, because it's becoming more and more apparent that it might be one of the big wins that they could actually accomplish this Congress.
Thank you. That's a great place to end. Again, appreciate everyone for joining us, and thank you, Frederick, Elizabeth, and John. We're recording this and we'll send around the link to the recording. And if you do have any questions after we end the call, feel free to email me, lholland@familiesusa.org. Thanks again, everyone, and have a great day.
Thanks. Thanks very much.